So welcome back to Senate Judiciary, February 19th. And we're switching topics now to recovery centers and corrections. And we have Julia Larson, who is from Turning Point in Bennington. Ms. Larson, would you like to start your testimony?
Yes, thank you so much for having me here. So I work at the Turning Point Center in Bennington, and I work literally on the front lines. I work in the emergency department. I work on the opioid response team, which is a program that we have where we're paged 24 hours a day, same as the emergency department, but we go directly to the scene of overdoses, and we try and encourage individuals to get help and to receive medical attention. A lot of times people are brought back to life through Narcan saving lives, but then they refuse to go to a hospital and be checked out. So our opiate response team tries to encourage them to go to the emergency room and engage in recovery services. One of the things I wanted to testify about is just that connection of needing continued support for peer-to-peer sponsored programs like that. It means a great deal to somebody in the emergency room, in the center, in the community, in a hotel, in an opiate overdose, when they have a peer with lived experience that can understand and say, listen, this was a struggle of mine once at some point, and I understand, and this is how you can navigate through the system, and these are the resources that we have available. And that's one of the great things about recovery coaching in general, is that they're very knowledgeable about what's going on and what beds are available and what it looks like in our communities for action. As you know, throughout the state, resources vary. Here in Bennington, we have no sober living, which creates a huge challenge for us. We have people that go to treatment, they go to detox, go to treatment, and are very ready for recovery, but come back to the exact same environment that they left. They have nowhere safe to come back to. And that's something we really struggle with in Bennington County, is not having housing. We're one of the only counties in the state without recovery housing. But we, like I said, we try and do our best to provide resources through the center, through the emergency department, and through the opiate response team to engage individuals in long-term recovery. Another thing I wanted to bring to your attention is that the majority of individuals that work in a center are volunteers. They're not paid employees, which really limits the amount of people that we can utilize. And honestly, there's a big gap in age and gender. It's just it's hard for someone who's 19 years old, opiate dependent, to talk to someone who's 57 years old and had a history of alcohol use disorder. So I think that in the future, making recovery a livable wage for people that want to work in recovery through recovery coaching, through Turning Point centers, is really, really important to look at, because they have a great amount of knowledge and they have compassion. I mean, these are people that give their free time to do this. And if we could get individuals who could get, a compatible wage, we would have a greater workforce to pull from, and could only make this an even greater opportunity for our communities. The centers operate on a pretty tight budget, and we try and do things for our volunteers, and we do have some paid recovery coaches, but it's fee for service, and it just gets very complicated, and it's not a very large budget. Sorry about that. It's not a large amount of money to pull from. And it goes for our entire recovery coaching staff. So it's not broken up per department.
Mhm.
I think the only other thing is I really appreciate everything that has been done for recovery. The TJ Donovan talked about it on Recovery Day, going after, the pharmaceutical companies. We really, as you know, and as we know, there's really nobody that wakes up one day and says, I want to struggle with substance use and have my community, kind of like bash me publicly and shame me and embarrass me. People struggle to get help because they don't want to be seen as a drug addict or an alcoholic. And we're very clear that we don't see people that way. We see them as people that struggle with substance use disorder, which can be as short-lived as long as we provide resources and the person is willing to commit themselves to a lifestyle of recovery. And we've seen it work. I get emails and letters from people that say, hey, I met you 2 years ago and I just got my 2-year coin and my life, I have my children back. I mean, I've witnessed miracles happen in recovery. And I just think that it's important, to keep funding recovery centers, to keep funding programs like recovery coaching and, the different programs that recovery coaches do, because they play such a big role in people's recovery. And I didn't know if you had any questions for me, but that's just kind of, what I had to bring to the table today.
I do have a question. I hear in what you're saying, especially the comment around the livable wage, that there's a general idea that we should be maybe putting more resources into the system. I'm curious because you're representing Bennington and Ms. Hauk is representing Rutland. Do you see any geographic disparity in how the resources get allocated, or is it just the whole system is underfunded?
I feel like the system is underfunded, but and I don't want to point out any one place in particular, but if you look at Bennington County versus Chittenden County, I mean, they have a huge amount of money compared to what we have. And it's a bigger population. There's so many different factors, but I mean, we have a huge problem here. I mean, we go door to door with the harm reduction bags to hotels, and our last poll was 87% of the people that we're housing for COVID have substance use disorder. So when that COVID housing money ends, where are those people going to go? And we don't have housing. We have nowhere for them to go. And we don't have like other counties, like Rutland Regional has the where they have a detox floor. Our hospital doesn't have that. We actually have to send people out of state. We sent over 100 people out of state last year for alcohol withdrawal and detox.
When you say out of state, do you mean over the border?
Yes.
Out of state? So not a significant distance from Vermont.
Not a significant distance from Vermont. We send them to St. Pete's or different resources that we have in Massachusetts, because we're in that corner of the state, so we can utilize some of those services. But we can't get inpatient beds for alcohol withdrawal, which is deadly. People come to the ER and they say, I want to stop today. And we're like, okay, well, in 3 to 5 days, we can get you into an inpatient bed. So we had to look at ways to get them help right away. And that was by taking them to different hospitals in Massachusetts and New York that accepted Vermont Medicaid, so that they could start their recovery journey right then. And those people, today are greatly, some of them, are in recovery, and those success stories are really amazing stories. So we try and keep people within the community for like outpatient, those kind of things. But We're really lacking in housing and we're lacking in treatment. Both.
Yeah, I hear you. The housing question for people leaving the correction system too is one of the big drawbacks. So there's a whole housing segment that we're missing. Other questions for Ms. Larson before we go on to the Rutland Turning Point Center. Senator White.
This isn't a question, but I just wanted to thank both of you for the work that you do. And I have pretty close contact with Susie Walker and Vanessa Sanchez here in Brattleboro. And they see a lot of this. I mean, of course, they see the same issues and and we just had, I don't know if you know this or not, but we had detox services at the Brattleboro retreat. And Agency of Human Services saw fit to close that down. So we have none now either.
I did hear about that. And it's unfortunate. I mean, we lost the Phoenix House in Brattleboro, the RISE program, the Women's RISE program in Brattleboro. So we're seeing like closures of really significant programs. That was a great program for corrections. I mean, the women that graduated Tapestry, I hear from on a regular basis, and there are literally hundreds of women that are successful, that have their children back, that are, contributing members of society. And that's another thing too. I didn't touch on this, but it's very hard for people when they have a history with Department of Corrections for employment. I mean, even a manufacturing job now is, the drug screen is fine. They can pass that, but they can't get up to a supervision or management level because they have some type of criminal history, and it could be 10 years old, 15 years old, and they've changed their whole way of life, but that holds them back for the rest of their life. And I don't know if there's a way to change that also, because people do things when they're on substances that they wouldn't ever do if they weren't chemically dependent on something. They're literally different versions of themselves. They're not the same people. It's one of the challenges we have with housing as well. If you have a conviction, you can't get into public housing. And we deal with lots of families that people are just really struggling to begin with financially, and then to support, a family of three. A single mother with 2 children on minimum wage in recovery, there's just very little in means of support for people, housing in general, corrections. We have the Depot Street program here in Bennington, which is a great program, and that could be duplicated throughout the state and would help with corrections, I believe. But housing, barriers to employment are great, and then the livable wage for people that want to have a career in recovery, not just a job, but they really, they want to give back, and you can't get that type of authenticity from anywhere really but a peer, because they just believe in people so much. And that was all.
Thank you.
Thank you.
Okay, Ms. Hauk, am I pronouncing that correctly?
Yes, you are. Good
Okay.
morning, everybody. I'm from I'm the director at the Turning Point Center of Rutland. And I wanted to piggyback a little bit on what Julia was saying. I think, what we struggle with at the center is, many of the people that become recovery coaches and do this work are people that have received services through us, and they've gained their recovery and they want to give back. The funding that we get a lot of times is for like recovery coaches to go into the emergency room, recovery coaches to do outreach, or, whatever the moms program. But what gets forgotten is the time that it takes to get many of these people trained and being able to offer them a position as they're working up to be a recovery coach, getting them the skills. I mean, to be able to go into an emergency department, you have to have a certain level of professionalism, right? Many of the people in recovery have never had that experience, or their work history is very spotty. You know, what it takes to get somebody to that level, we do that here at the center, and the expectation that they have to do that on a voluntary basis with no pay is just kind of ridiculous. I mean, you know, there's a lot of skills that they need to learn, and they need to be supported in their recovery. And that's what we do. We're supporting all of our workers. They're in their own recovery program too. So I think, you know, thinking about it from the bottom up, you know, how do we get people to do this work? You can't run an ad in the paper for a recovery coach necessarily. You know, it just doesn't start that way. So I just wanted to add that into it. You know, that's where we struggle. I have lots of people that want to do this work, but unless they're ready to go from the get-go, like to an emergency room or actually do coaching, I can't give them a position. So we're part of workforce development too, for many of these people.
Mhm.
So, but the main thing I wanted to talk about today was about our correctional program, which I've testified in front of you guys before. We just reached the end of our 3-year grant that funded that program. We will be continuing it. And the data that we got from it, we followed 113 people over that 3-year period. 111 of them have not reoffended. They have not gone back to jail. We've had a lot of other people we engaged with, but they didn't quite, you know, getting them to do the assessments and actually consenting to be followed has been difficult. But I can say, you know, when you look at that, that's like a 98% success rate. And when we got the average cost of incarceration from Marble Valley Correctional Facility, which is around $67,000. So if you multiply that, that's almost $7.5 million saved.
Mhm.
You know, and the connection that they feel when we go into the correctional facility is just amazing. There's a lot of people in there that want recovery, but they don't know, they don't trust. They feel less than, you know, their self-image, their sense of self-value. They're only going to be felons or addicts. That's what they think. That's how they're treated. You know, to be able to go in and just look at them as people and help them along the way, I think we're going to be able to reduce recidivism if we could make this a statewide program. You know, I think it'll have a profound effect on it. We did also with the recovery, for the recovery coaches, I developed with VAMHAR a specialized training for being a recovery coach in the correctional facility. It's a 3-day training. We piloted it in, I believe, September, and it was powerful. We had people from the jail that spoke about what it takes to become a volunteer and just about different boundaries and ethics. And I know a lot of centers are now getting referrals from caseworkers at the correctional facility. We got one yesterday from somebody that's getting released on Saturday. We were able to call the caseworker and make that connection, talk to the individual so that Monday when he can come to the center, we can meet him. And I think we just need to be able to build on that. And during COVID, it was hard. We couldn't go into the correctional facility as of March. So we couldn't do our groups. We couldn't do our one-on-one recovery coaching. But what we did is the individuals that were receiving recovery coaching, we connected with a volunteer coordinator at Marble Valley, and we started letter writing. And we, you know, the recovery coach that went up there wrote letters to them. We got letters back. We had probably about 4 or 5 individuals that were released during COVID, and they maintained contact with us. I mean, that's huge, you know, because usually out of sight, out of mind, you know. So being able to be present. And I do have another individual with me here, Robert Blaze. He's somebody that engaged with our correctional program when he was incarcerated about 3 years ago.
3 years ago, over 3 years ago.
Yeah, and he just wanted to say a few words too.
Absolutely. Mr. Blaze, if you could just identify yourself for the record, just your name and who you're representing. You can say concerned citizen if you like.
Robert Blaze. I represent Turning Point out of Rutland.
Great.
Basically, a lot like Tracy was just saying, you know, I just turned 41, and up until about 3.5 years ago, I called it Groundhog Day. It's just an endless cycle of repeating addiction and not knowing where to turn. And her program, when her and Tanya would come up to the jail, is what really turned my life around. I remembered walking by it, headed to the rec yard, and asking other guys what that program was, and they told me. And then the next time they were there, I started to walk by it again. And I remember telling myself, no, if you're serious about this, you need to turn around and go in that room. And I did. And it's been nothing but great for me since then. It changed my life. The programs they offered while I was in there, Making Recovery Easy and Smart Recovery. So I went to their groups for, I don't know, 7 or 8 months. And like she said, we did look forward to them coming. I would actually get up, I would be in a pod and I get to see them pull in. And I remember getting excited about being able to see these two women. And when the jail was locked down and they didn't allow the group or whatever, I remember getting upset over it. But anyways, I graduated both programs before being released. And once I got released, it gave me a place to go as well, because I never did any meetings or groups or anything before this. And while I was in jail as well, I had heard about the program drug court, and I had asked my lawyer about it if I was, a candidate. And I volunteered to do that program. I graduated last year, February 18th. I'm going on, well, I just celebrated 3 years of sobriety this last November. I continue to stay in contact with Turning Point. I've been 3 years in a row in front of you guys. Like Julia was saying, it is hard for us to get a job. If I didn't have a trade and didn't know people before I got in this trouble that didn't know who the real Robert Blaze was, I wouldn't have the foreman position that I have for Dalton Construction out of Waterbury. I'm one of the lucky ones. And I've done what I could do to give back as far as being involved in this program now. When I see people that are struggling for jobs, one of my positions is I can hire and fire. So I try to bring on guys that, if it's okay with their PO or whoever, I try to offer them a job because people gave me a chance. Mm-hmm. And, I'm driving a brand new vehicle now. I've lived in the same place for 4 years. I've never lived in any place longer than 2 months. It's just been a great feeling. And I've been a part of Recovery Day every year for the last 3 years. I've given back in any way that I can to help others. And this program started for me in jail. And I can't say enough about it. I moved away. I live in Bridgewater, Vermont now, but I still make a point when I'm in town to stop and say hi to the people that gave me this type of life or helped me get this type of life in the right direction. And it is unfortunate that some of these people don't have the help. I didn't know which way to go when I was in jail. I didn't know how to ask. A lot of it was I was embarrassed. I didn't want people to know the truth. Because part of it was because I didn't want to believe the truth. And I didn't want to accept that I had a problem. But one of the hardest things I've ever had to do was change. But this change is something that's the only regret that I have, is that I didn't do this sooner. I am who I am today because of the things I've been through, and I wouldn't change any of that. And I just can't say enough for how well this program has done for me. And I believe in, like they were saying, I believe anybody can do this if they want it. They really got to want it. It's a really good program. I would like personally, because when I would leave the Rutland facility and be transferred, we no longer had that. It felt like Tanya and Tracy were the only ones going into the jails and doing it. They didn't have these other programs in these other jails other than maybe an NA group or an AA group. It wasn't the same type of connection. And they didn't give us, they didn't make us feel like we had a place to go afterwards. But when she asked me to be part of this again today, I said, absolutely. This will make the 3rd year in a row. I want you guys to know that I'm still doing good. It's the same job. And life's great, and it does get easier. And I give back when I can. I wish I could do it more. I want to touch on a little bit what Julie said. I was asked to be a recovery coach last year. Same thing though, because of my job and not being able to devote the time that I need to devote to become a recovery coach. I had to make a choice.
Mhm.
So that, knowing that it was a volunteer thing and that I could, I have to do it in a different way. That was one of the, things I ran into, was because I can't give up, what job I do have just to volunteer, as much as I'd love to, just to volunteer most of my time. And I'm glad I can do when I can.
Mhm.
Thank you.
Well, thank you. I wanted to say you're a dramatic example of something that Senator White says all the time, which is that people change. And I can't think of a better illustration of that than what you just said. So
Thank you.
congratulations. Ms. Hauk.
Yes, I had the one thing, like, I have a letter here that I had another individual who was released last summer, 7 months ago, from corrections. He was part of our correctional program. Unfortunately, he couldn't be here today because he had to take his mother to get some tests done. But I do have a letter. So if I may, I'd like to read that letter.
Sure.
Hello, I am Peter Fenning. In July 2019, I was incarcerated at the Marble Valley Correctional Center here in Rutland after being charged with a DUI. My alcohol drinking had got me into trouble again. Totally out of hope to stop drinking, I prayed for God to take me in my sleep. He would not do it. Instead, God made available to me on the wall in the Delta unit was this piece of paper announcing a new way of alcohol recovery, group classes, and one-to-one recovery coach. I had no other option on the inside, so I signed up for both. This would prove during the next 12 months of my incarceration to be a life-saving, life changer for me. From 2 classes of instruction, I discovered my thinking errors and the ways to turn them positive. Gained hope that I too could learn from my mistakes and put the alcoholism into remission. While I progressed in my everyday with the positiveness and optimism that I never enjoyed before, I've gained hope in myself and my future through working the details of my condition while applying the tools from the 2 courses of recovery offered to me by the Turning Point Center of Rutland. To the recovery coach I went, a one-to-one. Here I was given support and stability to put all my programming together. This recovery coach knew about alcoholism and how it works and how for me to grow positive one day at a time. So well that I thought he was able to read my mind. Truly, the 2 recovery classes and the recovery coaches saved my life and maybe someone else's. The other guys in my unit and facility and me spoke all the time about our Turning Point recovery plan. And I became known as the guy to say, just say no and go to another meeting. Then COVID hit and we were all locked into our cells and visitors and volunteers were kept out. Depression set in, and us guys that were in the same unit continued our talks of recovery and began to reach out to Turning Point by sending letters out to the staff at the Turning Point Center here in Rutland. And the staff at Turning Point started to write back, aiding in our new desperate situation and giving us new hope and inspiration for us to continue to progress in our individual recovery. This continues today on the inside. I was released by the Correctional Center July 2020. I have continued these last 7 months to meet with my recovery coach each week. When I first got out of the Correctional Center, I broke my back in a biking accident. My recovery coach came out to my house each week to meet with me until I got better. Now I come into the center to meet and greet staff, feeling relief from my pain of alcoholism and feel secure that I am where my path into sobriety, one day at a time, is cemented. The Turning Point Center of Rutland. I thank you very much for listening, and I hope that you will ensure those in jail and out will have the same hope available to them that I found was available on the inside and now continues for me on the outside. God bless you all. And I think that speaks to, the letters we got from inmates. They would come to the center, we would read them over, and they kind of formed their own recovery support network in there. And I've said before, recovery pods would be huge in a correctional facility, where they could individually support each other, kind of be their own support network. I mean, I can't tell you how many positive things I have seen by being able to go into corrections and provide these supports. What happens when people get out? It gives them a place to go. It gives them people they trust, and they're seen as people, valuable people. So I just really would like to see more collaboration. I know we're getting referrals from case managers at the jail. We just started getting those about a month ago to some of the other centers. And I think just furthering this collaboration and working together, I think we're going to save a lot more people.
Mhm.
Thank you.
Well, thank you very much. Senator Sears is with us now.
Thank you very much. I'm sorry I missed part of the testimony. I've met Julia in the past down at the Bennington Turning Point Club, and I'm a big supporter of Turning Point programs. Fortunate enough to attend their recovery night. It was kind of odd during the pandemic doing it, but they did a terrific job. So. I'm sorry I missed some of the testimony. Please continue, Senator Baruth.
Okay. I believe we've finished the testimony, but I haven't asked for questions of Ms. Hauk from the committee. Doesn't look like we have any. Is Senator Sears, is there, not sure if you would like to connect this to a larger
Well,
discussion of.
I think every year, one of the things that we've done in Senate appropriations is shown great support for the recovery centers. They do a terrific job with limited resources, and given the role they play with in recovery, I thought it was nice to celebrate the Recovery Day, and it wasn't the way it normally is, where it's done in the State House. So I'm appreciative of these folks joining us by Zoom.
Okay.
But Senator Nitka has a question. I don't.
I was just wondering, I know of other successes too that have come from, the support of the recovery centers. Are the recovery centers the same as the turning clubs that are around, or are they located in the same location, or how does that work?
There's 12 recovery centers that are peer-based recovery centers located around the state. And we pretty much cover every county. So they're as far as Newport, and we all the directors come together, and we meet together, and we share ideas of what we're doing to how to support people in recovery. And we're all independent 501(c)(3)s.
And when I hear people say the Turning Point Club, I think some people refer to it as, are those at the recovery centers?
Those are the recovery centers.
Okay.
Yes, those are. And some of them have different, like there's Journey to Recovery Center, which is up in Newport. So some don't always have the Turning Point in their name.
I see.
Yeah.
The other thing, can I just ask one more question? The other thing was, I had heard, and I don't know if this is the case, but someone who wanted to get Narcan, a family member, in case their family member overdosed, or some of that family member's friends who were active users. And can they get Narcan for free from the recovery centers?
Yes.
They can.
Yes. And we also, I'll speak for our center. We do a lot of family coaching, so if you have a family member that's struggling, and say that individual in their family is not at the point where they're ready to get help. I've done family coaching for moms, to help them practice self-care, help them to establish boundaries, understand the thinking process when somebody is actively using, and it's been extremely helpful to families.
I see. Very good. Thank you.
You're welcome.
I do have a question, and that is, what is the relationship with, I guess we call it the central office, or the with each individual? I know a while back there was some concerns about have those been ironed out?
Yes, they have been ironed out. And I believe you're referring to Vermont Recovery Network, which is kind of like,
Yes, right.
yes, yes. And we have a tremendous working relationship now. VRN kind of supports all of the centers if there's certain issues. Sometimes there's things with policies that we need to put in place and kind of establishing trainings or resources, and the advertising for what the centers do. I mean, she kind of brings us all together so that we can be in a shared mission, even though we're separate 5013Cs.
I know there were some issues maybe 18 months ago, and I know there was some funding. We made specific reference in the Senate Appropriations Committee to that it going to the individual 12 Turning Point clubs, and not administration. There was. I'm glad to hear that that's kind of been ironed out.
Well,
Is that the experience in Bennington as well?
I believe so. I think that we're that whole situation has been resolved. And we work also a lot with VMR, which is separate from VRN. We do a lot of trainings with them, but we get a lot of support from VRN, and we work really closely with them on multiple different levels, especially for like the peer recovery coaching. They'll help us find peer recovery coaches. They do advertising and things for recovery coaching. So yeah, as far as I know, that has been.
And I want to add in there with the recovery coaches in the ER, in the emergency rooms, we have a recovery data platform that all the centers use for that. And that is pretty much managed through Vermont Recovery Network. And they get the funding and they provide the trainings. They have the tech support. That is a huge, huge project. And if VRN isn't funded to be able to manage that, that would be on each center to purchase their own recovery data platform, which the state requires us to submit certain data through there for the ED program. And I think, we need that support. The centers on their own can't buy their own recovery data platform. I mean, we don't have unrestricted funds to put towards that. So I think the management of that, the training that's gone into helping all the centers get up so they input all their data into that recovery data platform is huge.
One thing too, it's also been really helpful is that because that recovery data platform is every center entering the information, if I see somebody in the emergency department in Bennington that's from Rutland, we can collaborate with Rutland and say, hey, because we're all connected now, we have this individual who we have permission to talk. And, I've read through the recovery notes and, do they still have a housing plan in Rutland? We're able to use the different centers together with that platform so that we can see where they've come from, where they've been, what they're going through. And we can also do like a warm handoff. So if somebody wants to go, like I said, we have no recovery housing in Bennington. So if I want to send somebody to recovery housing in Barry, I'm able to talk to the recovery center and say, hey, this person is coming into your area. All the notes are in RDP, but I wanted to make sure that they had a coach to follow up with. And so we're able to organize that because of RDP, and keep it all in one place. And so it's been a really helpful tool.
And we've been able to develop with our correctional program, we had an individual that was part of our correctional program. All the information is entered in RDP. He happens to live up in Barry. He's a paraplegic. He can't get down here to Rutland. So we're able to share that participant with Barry Turning Point. So he gets support from us and also gets support from somebody at Barry for recovery coaching.
Did you already discuss folks who are not interested in recovery, and how you deal with that? Has that already come up?
No,
I've heard from EMTs that frequently they will resuscitate somebody with Narcan, and the person only wants to go back and, maybe using the next day or even that night. And how frustrating that is for them that they continue, and that these folks aren't interested in recovery at all. They're just interested in just
So I
staying
did-
alive.
Benny? Oh,
Yeah, go ahead.
Sorry, I didn't mean to interrupt you.
No, I think you got my question, I hope.
Yeah, so Bennington right now is doing a pilot program. We're the only county in the state that's doing it, but we have the opioid response team, which I talked about a little bit in the beginning.
Yeah,
And
really
what that is the recovery coaches going directly to the scene of overdoses. So we had one last night, and what happened, we have one we have them often, and sometimes they're fatal. And then we're there for the families of the individual who's passed away. But as soon as 911 is called, the recovery coach is paged to meet the EMT and police at the scene, to be kind of like a go-between, where we're not the police, we're not identified as medical staff, we're a peer, we're a person, to try to engage them in medical services. And I'll tell you that it's a completely different response. We get people engaged. There's been more engagement with people using the service than they had prior. So it's definitely been a success so far. And the fatalities that we've gone to, which are very, very difficult, we're there for the families, because the families have been through this whirlwind of recovery lapse, and just all the, everything that goes along with that. And so we're still able to support, no matter what we're there for, we're able to support our community. So even if it's, a husband or a mother or a 15-year-old daughter, there's somebody there that's getting services from the recovery center that are really needed at a very, very difficult time in their life. But people, we have more people that have decided to utilize the service and seek help. And then from there, we're able, we've had situations where we're able to put people temporarily. I was saying we have to send some people out of state, but we're able to put them temporarily in detox at St. Peter's, and then they go from St. Peter's to Valley Vista, and then from Valley Vista they come back to the community, and it's just another layer, kind of like how Tracy's saying, you start building that connection from day one, and they see a different coach in the emergency department because it's a separate program, but they kind of all coincide. So it's kind of the same people working in these different programs and different roles, and kind of patching together a career. And that's why I was saying it was important for a livable wage, because these are people that are on call for 12 hours and they get paid $50 for 12 hours. They can't be within 30 minutes of Main Street of Bennington. So they can't go anywhere. They couldn't go, anywhere within 30 minutes. They have to be able to respond. But they're only paid $50. So, if somebody calls, they get an additional small stipend for each call. But that's how both of those programs work, is fee for service and the $50 for a 12-hour shift.
Yeah, and that's we need to do a better job. I realize no matter what, it's a difficult job, and they're mainly volunteers who are committed to this, even if they are getting a $50 stipend. But we need to do a better job. I think I hear a lot of talk here about solving the opiate problem, but the action really comes in helping you folks to do the best job you can, and recognizing that.
Well, I think too,
I know a lot of the members in Bennington of the Turning Point Club who are recovery coaches. who are actively involved here. They're just dedicated folks. They probably do it for nothing. I'm sure some of them do, but it's kind of nice to be recognized with a little bit of cash.
Yeah, we run mostly on volunteers. We run most of our programs we go to motels bi-weekly to hand out harm reduction kits and try and engage people in recovery services. And that is done by people that get paid absolutely nothing, but are there just because they want to help. And then someone who's a center employee like myself. But I mean, our center has 3 actual employees. And that's it. So we have recovery coaches, but they're on a volunteer basis, or they get fee per service, and it's very limited in what we can pay.
Well, thank you all very much.
Senator
Nick, a final question.
I just wonder if Mr. Blaze is still with Tracy,
Oh, he had to leave.
because
I'm sorry.
he gave his story, Senator Sears, and it was something you would have appreciated with regard to him getting into recovery prison.
Well, one of the few good things about being remote is I can watch it on YouTube.
Oh, okay. His was a tale that you would appreciate. So.
Could I just make one
Senator
comment?
White, yeah, please.
So this was, I was thinking about it when Mr. Blaze was talking, and it reminded me that there's a construction company down here that the owner is in recovery and has been for a number of years, but he was really at rock bottom for a long time. And he now hires and mentors. His goal is to hire as many recovering addicts as he can, whether it's whichever substance it is. And he has a great construction company down here now. And he's doing major projects all over southern Vermont. So there is hope out there if we would just, I was reminded that sometimes we're looking at millions and millions of dollars for some things, and then things like this that are would take small infusions. They would look large to you, but they're small infusions in terms of the entire state budget, but they will really make a difference and have a huge impact, and probably make more difference than those huge budget items at the top. So just wanted to.
Well, and I'd like to add in there, one of the individuals that's part of he's come up to testify with me at Recovery Day in the past. He wasn't able to be here today, but he and his fiance have started a flagging company. And he has come to me and said that if there are individuals looking for jobs that have difficulties, and we know they're at a pretty good place in their recovery, to let him know, because he would hire them. I mean, and the hearts of people that are in recovery, they get it, they know. And I think, speaking to like the recovery coaches, I think people just tend to forget that recovery coaches are generally people in recovery, and recovery is not you're in there and you're good the rest of your life. It's maintaining your recovery. It's supporting them when they're going out and reaching people. Sometimes it may be people they know that they lose to overdoses. It's really, there's a lot to it. I'm a person in long-term recovery. I have to be mindful how my work is affecting my recovery. And sometimes you get a little burnt out and you wonder whether you're even making a difference, because you don't always see the successes,
Well, thank you both very much.
Thank you.
Appreciate
Thank
it. We
you.
have to move on to the next meeting, remote meeting, which is of the Senate at 11:30. So we have time to get from one Zoom room to the next Zoom room. I did want to end with a nice note that I just sent to each of you from John Sutek from Comcast. And Peggy, if you could post that note on the committee webpage. It'd be great. He
Yep.
says, thanks for the opportunity to discuss Comcast and our data plans last week in Senate Judiciary Committee. As always, I appreciate the frank and fair manner in which your committee handles issues. I wanted to let you know that we pushed any activation of usage-based data billing back to 2022. I don't have much more in the way of detail at this point, but my hope is that this eases some of the concerns you and the committee had. Per discussion, I've also followed up with Assistant Attorney General Christopher Curtis and let him know of our decision as well.
Great.
At least we did something right this week.
All right.
And
Well,
I think
thank you
that's
all.
good news that during the middle of a pandemic, people aren't going to be charged $100 for going over data usage.
Yeah, that's great.
All right.
Thank you.
Anyway,